And welcome to the Children's Safety Network webinar. This is on the safe use and administration of medication to young children. My name is Maureen Perkins. I'm currently serving as the team lead of the Poison Control Program at the Health Resources and Services Administration. This is a reminder that the Children's Safety Network project is supported by the Health Resources and Services Administration through a cooperative agreement. I will now turn the call over to Kate Sinclair, who has a few technical announcements.
Welcome, everyone. I'm Kate Sinclair from the Children's Safety Network, and if you can hear me right now, you'll know that the audio is being broadcast through your computer speakers. The quality of the audio is dependent upon your internet connection. If you're experiencing any audio issues, dial the number either on the screen right now or in the left-hand corner of our screen, and remember to mute your computer speakers. You will be muted during the webinar. Please go ahead and ask any questions in the Q&A pod on the bottom left of your screen at any time during the webinar. At the top of your screen today, you'll see our file share pod, which has our slides for today available for download. And then in our web links pod, you'll see some great resources from HRSA and the Poison Health website. This session is being recorded and will be posted on CSN's website within the next week. You'll all get an email notification as registrants for the webinar when it's posted. All right, Maureen, I'll hand it back to you.
Thank you. So today we have three speakers. We have Daniel Budnitz, a captain with the U.S. Public Health Service, who directs the Medication Safety Program at the U.S. Centers for Disease Control and Prevention. We also have Mary Leonard, who oversees the strategic management of the Consumer Healthcare Products Association, CHPA, Education Foundation. And we have Shonna Yin, who is a general academic pediatrician and an associate professor of pediatrics and population health at the New York University School of Medicine.
All right, good afternoon. This is Dr. Dan Budnitz from the Centers for Disease Control and Prevention. I'm going to begin our session today on safer use and administration of medications to young children by sharing 8 facts about the problem of pediatric medication exposures, overdoses, and errors, which are the basis for 8 key messages for parents and caregivers for the prevention of these unintentional pediatric medication exposures, overdoses, and errors. Now, both the facts and the prevention messages come out of a collaborative effort called the PROTECT Initiative. This is an innovative collaboration that began about 2008 to bring together public health agencies like CDC, FDA, the Consumer Product Safety Commission, and HRSA, along with private sector companies, particularly those who manufacture over-the-counter medications and their packaging, professional organizations like the American Academy of Pediatrics, American Academy of Family Physicians, and American Association of Poison Control Centers, and non-governmental healthcare quality and standards organizations, as well as patient education and advocacy organizations, as well as partners in academic centers. We were all brought together for the purpose of preventing pediatric medication exposures, overdoses, and errors. Now, the PROTECT Initiative has used a 3-pronged approach to try to reduce these medication overdoses and exposures. We worked to develop and implement new innovative packaging, which adds an additional layer of safety to existing child-resistant containers. Second, we worked to standardize dosing directions and dosing devices to reduce the frequency and severity of dosing errors that adults might make when administering medications to young children. You'll hear more about that from Dr. Shonna Yin. And our third approach, which you'll hear more about from Mary Leonard, is to encourage safer storage of all types of medicines and safer use and administration of medications to young children. So now I'll get to the 8 facts. Fact number 1, more children are brought to emergency departments for unintentional medication exposures and overdoses than exposures to all other types of consumer products combined. So let me be a little bit more specific. An unintentional exposure is when a young child gets into something, in this case a medication, but it can be a household cleaner, a laundry detergent, or anything else that could be toxic, on their own when a parent or other caregiver is not watching them closely. In this graph, you can see that emergency visits for these unintentional exposures most commonly involve 1, 2, or 3-year-olds. Those are the tallest bars indicated here. And at every age, there are more emergency visits that involve unintentional exposures to medications, the green bars, than unintentional exposures to all other household products combined, the white bars. Fact 2, children less than 5 years old come to the ED for medication harms at a higher rate than all others except for those 65 and older from medication harms. Now, young children are more susceptible to the adverse effects of medications than a typical full-grown adult. And when adverse effects from the unsupervised ingestions are also included, it makes the rate of ED visits for medication adverse effects more common among young children than for all but the oldest adults. Fact 3. In the 2000s, emergency visits for medication overdoses and exposures in young children increased by approximately 30%. It was not just ED visits, but hospital admissions and calls to poison centers for unintentional medication ingestions also rose 30 to 40% in the 2000s. Now, fact 5, emergency visits for unsupervised ingestions are more common than administrative errors. However, when errors do occur and lead to emergency department visits, they most commonly involve our youngest children, children less than 1 year old. Now, to put some of these population rates in perspective, it turns out that in the latter 2000s, about 1 out of every 152-year-olds was brought to an emergency department because of a medication overdose or exposure. And if we add up the risk for each year of life, children born in 2007 had approximately a 1 in 54 chance of being brought to an emergency department for an accidental medication overdose by the time they turned age 6. Now that I described the problem a little bit, I'm going to review some facts about preventing these adverse events. Fact 5. Child-resistant closures work well, but they're not child-proof. Here you can see poisoning death, which declined dramatically after the introduction of child-resistant caps that were introduced in the 1970s. However, death did not go to 0. Scores of children continue to die each year still from accidental poisonings. Why does this continue to happen despite the widespread use of child-resistant caps on medicines and other household products? Well, one reason is fact 6. If adults do not put child-resistant caps back on completely and correctly every time, these caps hardly work at all. Well, this might be obvious. We actually tested this fact as part of another study and found that even when caps were almost completely closed, young children could still easily unscrew the caps and empty the contents of bottles almost as quickly as if there were no caps at all. But not only do adults sometimes accidentally or intentionally fail to completely close the child-resistant caps on their medicines, adults intentionally remove pills from original packaging and is a common cause of many pediatric ingestions. So here you can see calls to poison centers that involving pills that most commonly cause toxicity in young children when ingested. And what we see is that for most of these medicines, at least half of the calls to poison centers occur after the pills were left out by an adult, that's the blue, or not in any container, that's in the, or not in any container at all in the blue, or pills that were intentionally taken out of their original shower-resistant containers and put in another container by adult, and that's in the green. And our final fact, administration mix-ups can lead to multifold medication overdoses and also underdosing. We'll hear more about this from Dr. Yin, but let me just, at this stage, introduce this table that shows some of the most common types of dosing errors made by parents and caregivers that can lead to these overdoses. They involve mixing up teaspoons and tablespoons, involve mixing up spoon measures and milliliter dosing, and finally they can involve misreading decimal points. In the 2010s, armed with these 8 facts, the PROTECT Initiative partners set out to develop and focus test key educational messages designed to encourage safer medication use and storage practices by parents and caregivers. And the Up and Away, Not Out of Sight campaign began. First message was to pick a place that your child cannot reach. Find a place in your home that is too high for children to reach or to see. Walk around your home and find the best place to keep your medicines and vitamins up and away, even between doses. Number 2, never leave loose pills or liquid medicines out on a counter, table, or bedside. To a young child, pills can look like candy, and liquid medicines can look like sugary drinks. So it's important to keep them out of children's reach and sight in child-resistant containers until right before you take them. Number 3, whether at home or away, keep medicines in their original child-resistant containers. If the medicine has a locking cap that turns, twist it until you can't twist it anymore, or you hear the click. If you must put medicines in other containers, such as a pill organizer, check to see if they are child-resistant. Many are not and can be easily opened by young children. 4th, teach your children about medicine safety when they're old enough to understand. It's important to teach your child what medicine is and why you or another caregiver must be the only ones to give it to them. Never tell children that medicine is candy, even if they don't like to take it. 5, inside homes with children, discuss keeping medicines in a safe place. Remind your guests to keep purses, bags, or coats that have medicines in them up and away and out of sight when they're in your home. And if you bring medicines into a home with young children, don't be shy about asking for a place to put them that is out of sight and reach. 6, be prepared in case of an emergency. From anywhere in the country, you can call the Poison Center, Poison Help number, 800-222-1222, from any state at any time for expert advice. Make sure that babysitters and older children, grandparents, and others, frequent family visitors, have this information too, in case of emergency when they're in charge. And remember, you can call the Poison Help number right away if you think your child might have gotten into a medicine, even if you're not completely sure. And 7, make sure that medicines carried with you are kept out of sight and reach of young children. Make sure those medicines that are in purses, bags, pockets, or pill organizers are also kept out of reach of young children, even when you're traveling. And finally, number 8, use dosing tools, not your household kitchen spoons, to give oral liquid medicines to your child. Use the dosing device, like an oral syringe or dosing cup, that's included with the product. And if a measuring device is not included with the product, ask for one from your pharmacist, or you can purchase one at a pharmacy. Now you'll hear more about resources to use to encourage safer use and storage of medicines for family members and caregivers, and additional resources for safer medication administration by parents or caregivers. And with that, we'll be happy to answer some questions and hear from our other speakers on these prevention messages.
Thank you so much, Dr. Budnitz. For those of you who have questions, thank you. Please go ahead and type them in the Q&A pod. Is over on the bottom left of your screen, and we're going to be answering questions following all of our presentations today. So next we're going to hear from our second presenter, Mary Leonard.
Great. Well, thank you so much, everyone, for having me today. My name is Mary Leonard, and I am the Managing Director of the CHPA Educational Foundation. We are a 501c3 organization dedicated to promoting the safe and responsible use of consumer healthcare products. So that includes over-the-counter medicines and dietary supplements. And so one of the key issues that we work with on the CDC medication safety team and the PROTECT initiative is preventing accidental unsupervised ingestions in young children through our campaign called Up and Away. And as Dr. Budnitz mentioned, this was truly an increasing public health problem in the early 2000s, with the number of young children being brought to the emergency department for accidental medication overdoses rapidly rising. So you can see here on the screen, more than 70,000 per year, nearing almost 80,000 in 2010. So we knew we needed a solution. And, you heard about the PROTECT initiative that Dr. Budnitz talked about. Well, under the Safe Storage work stream, that's where the Public Health Initiative Up and Away and Out of Sight was launched. In partnership with the CHPA Educational Foundation, my organization. And, the Up and Away campaign is all about teaching parents and other caregivers tips to safely keep medicines up and away, out of the sight and reach of young children to prevent accidental unsupervised ingestions. And we launched this campaign in 2011, so we have had more than a decade of sharing our educational messages to our audiences. So what exactly is Up and Away? It is an evidence-based, data-driven campaign. It's rooted in the latest insights on accidental unsupervised ingestions, and our strategy is twofold. First, our goal is to reach more parents and caregivers with our content. We currently reach millions of English and Spanish-speaking parents and caregivers each year through an integrated marketing communication strategy at both the national and local levels. But we're always looking for ways to increase that reach. And one of the ways we can do that is through our second strategy, amplifying those educational messages through our partner networks and other trusted sources. So with support from CDC and its PROTECT initiative, Up and Away can be shared across so many more platforms and communities than we would be able to do so on our own. Now, we heard a little bit about the specifics of each of these core messages for the campaign during Dr. Budnitz's presentation. These were focus group tested and updated just a few years ago, specifically addressing kind of this challenge and risk that comes with the use of alternate medicine containers or pill minders. So from a campaign perspective, we have these core messages. How do we communicate these to our audiences? Well, we have a variety of strategies that we use that have proved to be successful over the years. And, one of the most successful ways that we kind of think about and communicate these messages is through communication rallies. And so at its core, Up and Away is an awareness campaign. So these communication rally points are tied to seasonally relevant times throughout the year that align with larger health and safety conversations where we know medicine safety will be top of mind for parents and caregivers. So things like National Poison Prevention Week in March, or National Safety Month in June, Grandparents' Day in September, or cold and flu season when we know that more medicines might be in households. So we focus on both English and Spanish-speaking audiences through both earned and paid media strategies. And really for any given rally, we have a social media toolkit that is distributed to our PROTECT partners to really encourage social media promotion and engagement across their networks. And we utilize testimonials to elevate the emotional relevance of this issue and both motivate parents and grandparents to take action. Those have been extremely effective. And through our targeted paid media strategy, we kind of look at a lot of different platforms, but recently we've been experimenting with Hulu, with YouTube, and of course Facebook and Instagram, all different ways to connect with parents, with caregivers, and with grandparents and an older adult audience, promoting our educational messages and videos during specific touch points throughout the year. Now, we also utilize a series of collaborations that have helped promote the campaign. Retailers like Harris Teeter in 2019, who displayed our campaign poster at the pharmacy in all of their stores. Or CVS Health in 2018, who helped us reach 150 million shoppers across 8,000 stores with messages on their receipts and a PSA in their store. We also partnered with influencers like 2020 Miss America Camille Schreier. She has a passion for promoting medicine safety, and so she recorded a video on the importance of medicine storage for us and shared the video across her social media platforms during National Poison Prevention Week that year. So that really helped us amplify our reach as a campaign as well. And then finally, we have a bench of healthcare providers that we can tap who really help support the credibility of the campaign and help spread awareness of the campaign through different media outlets. On the screen here, you can see there was a local Houston station who wanted to cover, it was during cold and flu season, and wanted to cover, what are some ways that we can keep children safe from accidental medication overdoses with additional cold and flu medicines in the home. One of our spokespeople, Dr. Jessica Peck, she's a nurse practitioner, and she's from Houston. So we tapped her. She was able to go on and share information about the campaign and provide key tips for listeners. So that's just one example of how we can utilize our healthcare provider spokespeople as well. Now, we know that our target audience is parents and caregivers, so health and parenting sites are a wonderful way to share our messages. We have had an opportunity to work with WebMD, with What to Expect, with Philips Digital, their baby app, in a variety of different capacities, so drafting articles for their sites or crafting social media posts for their networks. Patient Point, another great example. They're a point-of-care marketing network. Last year, they ran our Up and Away poster and our PSA in their pediatric brochure, in exam rooms, and in waiting rooms of more than 13,000 offices representing more than 61,000 healthcare providers. And I should also mention, these are all in-kind collaborations for the campaign. We are a nonprofit, so it's especially important to try to think of ways that we can kind of amplify the message without a huge cost associated with it. So these are in-kind collaborations that I've been mentioning. Now, we've talked a lot about national outreach and the different ways that we do that, but we're also sharing our messages and materials at the local community level. So we've shipped more than 130,000 Up and Away free posters and brochures in both English and Spanish to community health centers, state poison centers, coalitions, faith-based organizations, Head Start programs, medical centers, just to name a few, all across the country. So we know it's important for the campaign to have additional touch points within the communities that we serve. And when we take a look at evidence, like how are we measuring success? Well, we now have updated data from the CDC, and we can say that since the PROTECT partnership was established and the Up and Away campaign launched, there has been a 46% reduction in the number of young children brought to the emergency department because of accidental medication overdoses. So that's almost 30,000 fewer emergency department visits per year than when these medicine exposures spiked more than a decade ago. So over the past 10 years since our campaign launched, we know that education is one piece of the solution here that is impacting this trend line, and we want to continue to see those annual visits decline. So for those of you joining us today, if you are a maternal and child health expert, if you are an injury and violence prevention specialist, I would invite you to share these free resources with your patients and audiences. On our website, upandaway.org, we have free brochures in English and Spanish. We have coloring books. We have tip sheets for parents and grandparents, and you can visit the link here on the webinar platform to explore the different resources that we have. Now, we also have social media and communications toolkits. We have sample posts, sample newsletter articles, and a full image library of the campaign's different videos and graphics that you can choose from and use. Or you can reach out to me and I can package up a custom shareable toolkit for you based on who your audience is. And again, the link is available on the webinar platform to access these different images and toolkits. And to close, I want to thank you all so much for the time to share about Up and Away and our resources with you. But I wanted to leave you with one last related resource. And as we talk about safe storage, we know that safe use is also extremely important, especially the administration of medicines in young children. And so to that end, the Foundation worked with the PROTECT Initiative and recently launched a safe dosing photo gallery. This depicts all of these images here depict best practices when both measuring and giving liquid medicines to children. So the link is available for you to to go to. There's 80 free images here to download and use in your communications from a variety of kind of diverse, multicultural parents and caregivers. And I hope that you choose to use and share these images so that we can spread the accurate depiction of safe dosing more broadly. And with that, to continue the conversation on the safe administration of medicines, I will turn it over to our next speaker, Dr. Shonna Yin.
Thank you so much. Again, if you have questions, please go ahead and type them into the Q&A pod, and we will answer those at the end of our presentation. So our final speaker is Dr. Shonna Yin.
Great. So we'll shift gears now, and we'll talk about some strategies to encourage safe medication use in children, focusing on medication administration and preventing medication errors. So what I'm going to do today is I'll start by giving an overview about outpatient medication errors in children, bring a little bit of a health literacy perspective to how we think about this issue, and then I'll give some highlights of recommendations from a recently released policy statement from the American Academy of Pediatrics. This came out in December 2021. I'm one of the lead authors and worked really closely with the Council on Quality Improvement and Patient Safety of the American Academy of Pediatrics, as well as the Committee on Drugs. So we'll talk briefly about that, and then I'll end by covering some resources to support safe outpatient medication use in children. So as you may know, outpatient medication use in children is very frequent. More than half of U.S. children are taking one or more medications in a given week, and this includes prescription medicines, over-the-counter medicines, vitamins, supplements. And outpatient medication errors in children are very common. Over 85,000 Poison Control Center phone calls happen each year related to medication errors. There are over 5,000 ED visits per year for medication errors involving overdoses. And prior studies have found that over 40 to 50% of caregivers are making dosing errors. And there are clinical implications of this. Giving too much of a medicine can increase the likelihood of toxicity. We believe that medication administration errors account for the majority of preventable pediatric adverse drug events. And errors that involve underdosing are also important to consider. This can contribute to therapeutic failure, a child's symptoms not improving, and that can lead to increased healthcare utilization and poor outcomes. And even though a single medication error might not have serious implications, when errors are made over and over again across multiple doses, there becomes a growing concern for harm. And who's at risk? Dr. Budnitz spoke a little bit about this earlier. Young children who are 5 years old and under are at risk. Also children with chronic medical conditions who are taking oftentimes multiple medicines with complicated administration instructions and who might be getting care from multiple caregivers are at risk. There are many kinds of home medication administration errors that occur. This is a snapshot of a table from the annual report of the American Association of Poison Control Centers. They report on these errors annually. So some of the errors that they're seeing, and I'm highlighting some here in red, include errors in frequency. That includes giving doses too closely together. Sometimes that happens when there's multiple caregivers for a child. One person doesn't realize the other already gave a medicine. There can also be dosing mistakes, right? For example, multifold errors from mixing up units of measure or confusing decimal points. There can be incorrect route of administration, for example, giving a medicine in the ear instead of by mouth. There can be administration of incorrect medications or formulations. And there can be errors in use of dosing tools like dosing cups. Other errors that aren't highlighted here include errors in duration, so stopping a medicine early, not giving a medicine for the full recommended course. Also incorrect preparation or storage. Certain medicines need to be stored in the refrigerator, for example, and use of expired medicines, medicines that may no longer have the same potency. With children, it's important to talk about liquid medicines. Liquid medicines are typically relied on by pediatricians for oral medicines for young children, and studies have found that liquid formulations are involved in over 80% of pediatric medication errors. Liquids are challenging to give correctly. Parents are often confused with the dosing instructions. They're confused by the units of measurement, like milliliters, teaspoons, and tablespoons. Dr. Budnitz mentioned earlier, these terms can often be used interchangeably when even within a single medication, and this increases the risk for multifold errors. There's also confusion with decimal points, and that can increase the risk of tenfold errors. And then with liquids, parents also need to recognize that kitchen spoons shouldn't be used to measure out medicines, and that standardized tools like syringes, cups, droppers, tools that have calibrated markings are preferred. But parents might not know how to use these tools correctly. I'm going to jump here and talk a little bit about health literacy and its link to medication errors. As many of you know, health literacy has to do with the degree which individuals have the capacity to obtain, to process, to understand health information and services that are needed to then make health decisions and to take action. And low health literacy affects nearly 30% of U.S. parents. But I think what's even more important to note is that only about 15% of U.S. parents have proficient health literacy. So that really means that the vast majority of parents in the U.S. face health literacy challenges. And so what are the implications? We know from prior studies that caregivers with low health literacy have greater difficulty understanding prescription and over-the-counter labels, have a much increased likelihood of using non-standard kitchen spoons, have trouble understanding concepts like active ingredient information and weight-based dosing, and have an increased odds of making dosing errors. I do want to introduce, however, this framework for thinking about health literacy, and I like to use this framework because I want to frame the problem of medication errors not just as a parent or a patient issue, but really as a health systems issue. In this framework, health literacy is at the intersection point between what caregivers and patients bring to the table, which is shown in that yellow arrow, their skills and their abilities, and what we in the healthcare system bring to the table, which is shown in the red arrow, the demands, the complexities of the tasks that we are asking caregivers and patients to do. And what I really like about this framework is that it emphasizes the shared responsibility between the two groups and how we really want to optimize this relationship so that we can really support and meet the needs of patients and caregivers. I want to put ourselves for a moment in the shoes of a parent or a patient and trying to understand how to give medication correctly at prescription medicine. And for a typical parent, they might have encounters within the clinical systems, in the clinic, ED, or hospital, which I'm going to show on the left what some of those challenges are, and then they might face challenges in the pharmacy setting as well. Okay, so at each of the stages of trying to figure out the medication instructions, there are challenges. So physician counseling is often incomplete. We know that from prior studies of recordings of those encounters where important information is left out, perhaps about indication or frequency or duration. And we know that few providers are using health literacy-informed counseling strategies like TeachBack to confirm understanding. We know that few providers provide dosing tools, even though we know that when those tools are provided, parents are more likely to use standard tools instead of kitchen spoons. Prescriptions are often missing information, and providers often don't give out written information about the medication course that's easy to understand. In the pharmacy, families typically are not counseled by the pharmacist. And studies show that it's not necessarily standard of care for pharmacies to provide a dosing tool when liquid medicine is prescribed. And that leaves the medication bottle. Oftentimes, those bottles are not designed in a patient-centered way. Elements that are bolded or highlighted or in color are things that might be helpful for the pharmacist, but not necessarily for the patient. And then finally, we think about the written information, the information that's clipped on that bag that's given to you when you leave that pharmacy. Studies have looked at that information and found that those materials are often written at too high of a reading grade level, 10th to 12th grade, too high for the average individual. And we're typically recommending a 6th to 8th grade reading level for the general population, 4th to 5th for a low literacy population. So you can see clearly that families are facing many, many health literacy challenges that they're trying to understand prescription medication instructions. Therefore, not all that surprising that they're set up to make medication errors. And then you can imagine layering on top of that the issues around limited English proficiency. I also want to touch briefly on this issue of OTC medicines as well. Caregivers and patients often don't get guidance from healthcare providers when they're using OTC products, and you can imagine the challenges there as well. They're often needing to rely on their own health literacy skills, the health literacy skills of their family members, to figure out what medications to use and how to administer them correctly. I'll now talk a little bit about the recommendations from the 2021 AP Policy Statement on Preventing Home Medication Errors, and I'll briefly highlight especially the areas that intersect with the priorities of the CDC's PROTECT initiative. The first set of recommendations centers on strategies to improve communication with caregivers and patients. Part of this first recommendation is to promote use of appropriate dosing units when we communicate about dosing instructions. So we want everyone to use milliliter or ml only units, and we want everybody to avoid spoon-based units like teaspoon or TSP or tablespoon, TBSP, or non-metric units. Why do we want that? Well, as we've mentioned earlier, when multiple units are used, there's an increased risk of multifold errors, right? So confusing ml with TSP leads to a 5-fold error, TSP and TBSP, a 3-fold error. We know from prior research as well that prescription labels that include teaspoons, even if they also include ml, are associated with a 2.5-fold increased odds of error compared to labels that are ml only. And research show that the benefits of ml only instructions is seen across health literacy levels. In addition, the use of spoon-based terms really inadvertently endorses the use of non-standard tools. So prescription labels, this is a study around prescription labels that included spoon-based units versus ml-only units, were associated with a greater than 4-fold increased odds of caregivers preferring to use a kitchen spoon. And we know that there's a much higher rate of dosing errors with kitchen spoons. Kitchen spoons are highly variable. You can just look in your kitchen drawer and you can look at this picture, highly variable in size and shape. The next part of recommendation 1 focuses on dose amounts. We want prescribers and those who dispense medicines in the pharmacy to use dose amounts that are easy to measure. We want them to avoid fractions or decimal amounts when possible, to try to use whole number amounts. And we want, when those numbers are displayed, to include leading zeros, so 0.x, and to avoid trailing zeros, x.0. We want consumers to also know that they should be extra careful when there are fractions and decimals involved. And the reasons why? Well, fractions and decimal amounts increase the likelihood of error. And these recommendations really align with the recommendations from the Joint Commission, right? There's an increased risk of 10-fold error when leading zeros are left out and when trailing zeros are included. And then another part of recommendation 1 is to learn and use health literacy-informed communication strategies. That includes using plain language. We know plain language is preferred by parents, that it's associated with increased medication knowledge. And we're also recommending using teach back or show back. Teach back has to do with having a parent or a caregiver say in their own words how they would follow instructions at home. Or with show back, you can have the parent demonstrate back or show back how they would do something at home. And that's considered a best practice from the Agency for Healthcare Research and Quality. It's been associated with improved outcomes, including improved glycemic control among diabetic patients. And finally, using pictures and drawings. I think this is a little bit of a no-brainer. We know that use of pictures and drawings can really improve understanding. It's been associated with reducing large dosing errors, and there are studies showing that there may be differential benefit, especially for those with low literacy, when we can include pictograms. You can see this is an example of a prescription label that includes a pictographic diagram of how much to dose. Finally, prior research has shown that using a comprehensive health literacy-informed counseling approach, including using plain language written materials as a framework for counseling, including pictographic dosing diagram and a log for tracking medicines, as well as incorporating teach back and show back, leads to multifold reductions of dosing errors and significant increases in adherence, and their benefits seen across all levels of health literacy. And this is a snapshot of that intervention of one of the instruction sheets. An intervention is called HELPIX. The second recommendation focuses on standardized dosing tools. And we really recommend and encourage the use of standardized tools with all liquid medications. As we all know, there's a wide variety of dosing tools, dosing spoons, cups, oral syringes, droppers. They come in all sorts of sizes and shapes, but oral syringes, there's general consensus that those should be the ones that are used and provided when dosing accuracy is important. I want to highlight a few things about dosing cups, which are typically more error-prone than other tools. And studies have found that when you compare oral syringes to cups, there's a multifold increased odds of error. The risk of multifold errors are especially high, especially for those small dose volumes. And the question is, why are cups so hard to use? Well, sometimes people think filling up the full cup is the right dose. Sometimes people don't hold the cup correctly. They don't look at that cup at eye level. They hold it up at an angle, and then they make errors in measurement. And for larger volume doses, these errors might not be clinically important, but for smaller dose volumes, these errors could be significant. we're really recommending oral syringes for doses that are less than 5 ml, medications for young children, medications with narrow therapeutic windows. Another part of the second recommendation is also around dosing tools and thinking about the size of the tool. We really encourage providing dosing tools that are the smallest size to fit the dose. That you can imagine, for example, if you are asking a patient to dose 7.5 ml, that would be better to ask them better to give them a 10 ml syringe where you only have to fill it up once versus challenging them with their numeracy skills and having them fill it up multiple times. We also don't want to provide a tool that's too large or recommend a tool that's too large for the dose. And you can see here, for example, for a 2 ml dose, you might want to have a 5 ml syringe versus a 10 ml syringe where there's much more room for overdosing error. So we really recommend providing dosing tools that really closely match the dose volume and that really does reduce errors. And we're seeing, again, greatest benefits, especially for those with low health literacy. And finally, we recommend that you encourage caregivers to ask for a dosing tool with all prescribed medications and use those medication-specific tools each time medication is administered. Now, I'm not going to go over the other recommendations in detail, just to highlight that there are a few key areas, including around information on prescriptions being kilograms only, recommendations around medication reconciliation, encouraging providers to access educational modules on safe prescribing practices and health literacy-informed patient education, as well as safe storage and administration, promoting safe medication disposal, as well as encouraging government agencies and industries to adopt measures promoting home medication safety. I'll shift gears now and talk about resources. So I just want to point out that within the AAP policy statement, there's a table 3. There is a table of helpful resources. So you can look here, and I can highlight just a few things that are listed in that table, as well as some other resources. So one thing that's we recommend is looking at the HRQ's Universal Precautions Toolkit. That toolkit covers strategies like plain language, teach back, and written information, how to approach written information. The AP has a book called Plain Language Pediatrics that includes medication-related handouts that are really patient-friendly, that don't include a lot of medical jargon and include great, simple, purposeful illustrations. And so there's handouts there on how to use liquid medications as well as choosing and using over-the-counter medicines. This resource here is related to the health fix intervention I mentioned earlier for the comprehensive health literacy informed counseling strategy. And then associated with the policy statement, there is actually an implementation toolkit that was created by the Patient Safety Committee of the Council on Quality Improving Patient Safety. This includes both provider as well as parent and family resources. In terms of provider implementation resources, there's a guide on implementing practice-based error reporting, a guide on how to integrate medication reconciliation within your practice, a guide on how to improve communication to reduce medication errors. We also have listed quite a few patient and family resources with lots of links. A lot of those links are to the AAP's website, healthychildren.org, although there's also links to CDC and FDA resources. Within those resources, there is a website page on liquid medications in children that covers key topics like units of measurement and dosing tool issues. We have a web page on OTC medicines and safe use, as well as medication safety tips. And that includes information on unintentional ingestions as well. And then finally, one of the resources that I really love that we developed are these pictographic dosing charts for acetaminophen, for ibuprofen, and for diphenhydramine. And these are fully revamped versions of what was previously online, which were dosing charts that didn't include pictographic information. So I think this will really provide helpful information that can be printed out and shared with your target audiences. And then finally, just to point out a few helpful health literacy tips. One is if you are someone who makes decisions about what handouts to give out or is developing handouts, here's some tips around how to assess readability. There are free online calculators to assess readability, as well as even within Microsoft Word that you can assess readability and get a reading grade level on materials that you're working on. So One thing just to say is that they typically will present the information using something called a Flush-Kincaid grade level, and just you want to be a little bit careful about that because that tends to underestimate reading levels. You might want to add 1 or 2 to be safe. And again, we're trying to reach a 6th to 8th grade level for the average person and 4th to 5th for a low literacy population. And then really encourage people to think beyond readability, because it's not just about reading grade level. That's important. There are other important aspects like understandability and actionability. And so there are tools, for example, like this tool from the Agency for Healthcare Research and Quality that help you assess patient education materials and look specifically at understandability and actionability. And this particular tool can be used for both print as well as audiovisual materials. I encourage you to take a look at that. So I think I'm going to end here. I hope that this is helpful, that you'll use a health literacy lens in thinking about how to approach medication errors with your target populations. I'll stop here. Thank you.
Thank you so much, Dr. Yin. I know we've had a couple of questions come into the pod, so we're going to go ahead and start having some of those answered by our presenters. All right, I think the first question that came in we'll have during Dr. Budnitz's presentation. Do the numbers on medication overdoses include data for cannabis?
Yeah, thank you very much for that question. And the simple answer is no. There are additional ingestions for cannabis or marijuana. There's one very niche product that is Marinol that's based on cannabis that would be included, but for large part those numbers do not. So that is an additional ingestion hazard for young children as well.
Thank you. We have another question that came in during Mary Leonard's presentation. Do you ever talk to farmers about keeping livestock or pet medicines up and away? Do you have resources for farm parents to lock up medication on farms?
We have not gone into farmers or livestock or pet medicines. It's primarily been just focused on children's medicine safety, but it's certainly a good suggestion and something that we can consider for the future for the campaign.
A resource that came in from one of the attendees was Rhode Island's Injury Prevention Program created an over-the-counter, does not mean on-the-counter, to address intentional and unintentional overdoses that were occurring in 2021 with over-the-counter and prescription medications in teens. And Jeffrey Hill included a link to that, so thank you so much for sharing that. And we have a question for Dr. Yin. I have heard moms say the syringes are so hard to wash, so I just use a spoon. Have you heard that before, and how do you react to that?
Yeah, I think those are legitimate concerns, and we should definitely be thinking about how we can make things easier for families. So if syringes, can be designed so that they are easy to wash, and there are some that are more easy to wash, and also that they can be washed so that the markings don't come off. I think that would really help consumers because we really do encourage people to use oral syringes. And there are many different kinds, so maybe there's a different kind of syringe that she could purchase that or get from the pharmacy that are easier to take apart and clean. But I think it's worthwhile because that really reduces the likelihood of her making an error with the kitchen spoon.
Thank you. We had a number of questions that came in when folks registered for the webinar, so we're going to start with some of those. The first question is, other than child-resistant packaging, have there been any new engineering solutions to this problem?
Yes, this is Dr. Budnitz, and I touched on one briefly, but the use of flow restrictors or bottle adapters has been one of these new engineering changes for liquid medicines. And what that flow restrictor is, it's a really simple idea. It's the idea that even after you have a child-resistant cap, you have a part of the bottle that is has a much more narrow opening. So instead of having a large opening of the bottle, you actually have a much smaller one. And sometimes that flow restrictor can even have a valve, or it can have a silicone opening that is pierced by an oral syringe, so it closes up completely. And those make it a lot more difficult for young children to get into medication, even if a parent accidentally or intentionally leaves the cap off. So that's one example of child-resistant packaging that really has been shown to reduce medication ingestions and emergency department visits in children. I will add one other thing. It also encourages parents to use a dosing device rather than a household spoon. So it has that added benefit of encouraging more accurate dosing tools as well.
Thank you, Dr. Budnitz. We have another question. I work with a lot of multi-generational households where so many of the prevention recommendations for poisoning and other injuries are difficult to implement. Do you have any suggestions for poisoning prevention for this type of family?
So maybe I'll give it a start, but then open it up to others to add, Mary and Shonna. And I'll start with a low-tech option. And that is, yes, there's a temptation to leave medicines on the counter, as our colleague in Rhode Island has noted and made some education about, because it's easier to remember to take your medicine if you're an adult and you take many medicines and have to take it several times a day if you leave it on the counter. But as the questioner asked, that is a problem. I think if in multi-generation homes, when there's a young child that can see those, they may look like candy, they may look like something enticing to play with, and they're left in view. And so a simple answer is to, instead of leaving the medicines themselves on the counter, leave yourself a note on the counter to remind yourself to take these medications. So the note can still be fully visible on the refrigerator or on the counter, as long as the medicines remain up and away and out of sight. So that is one tip that I think we can offer folks. And then my colleagues might have some more.
Yeah, I think that's a good tip, Dan. And I just, when it comes to up and away, many of our messages are targeted to multi-generational families with grandparents living in the home. And really every family's kind of safe storage practices differ. So we try to position our messages as helpful tips and guidance. So, when we're communicating to a grandparent about the use of the pill minder and making sure that you're putting it up and away, or if you're traveling with it, keep it zipped in a purse or bag, and when you get to your destination, make sure that purse or bag is placed up and away and out of the sight and reach of curious little children. We present these tips as helpful guidance, and then we want each multi-generational family to kind of come up with what works best for them and their circumstances, while really understanding the risk of leaving the medicines out. So I do like Dan's tip, because I think that would be really helpful. Shonna, anything to add to this one?
No, I think both Dan and Mary did a great job responding to that, and yeah, very comprehensive response. I think each family deciding what would be the best strategy that works for them, and understanding what the risks are in terms of leaving things out.
And I'll add one last point, and that is for folks that are a little more high tech than I. Speaking about notes on your refrigerator and on your counter, there are also medication scheduling apps on folks' smartphones and other devices that can be used as a reminder, instead of that bottle sitting in the middle of the kitchen or on the counter, to take your medications, as opposed, and that's a much safer way in terms of young children ingestion.
We have another question for you, Dr. Yin. Could you talk more about the teach back, show back, and how does that work best?
Yeah, I think a lot of times people feel a little intimidated around using teach back and show back, because they feel like they're putting someone on the spot and might make the other person feel uncomfortable about, doing that, like they're putting someone under a test. And they also, I think a lot of times people don't do teach back because they worry about how much time it's going to take. So I think, just a few tips around teach back is to really, think about, what the key point is that you want to have that the patient or the caregiver understand, and you don't have to do teach back about everything. If you think, the most important thing is around teaching back about like the dose and making sure they understand that, you can center your teach back, and that limits the amount of time it takes to do the teach back. And then I also, another tip is just I usually like to put the onus on myself. Like I want to make sure I did a good job explaining, whatever it was, how to give that, give Billy his medication. So, so it really puts the onus on yourself as opposed to like you're testing someone. It's like, it's my responsibility to do a good job conveying that information. So having that, I think framing, I think really helps with doing teach back with families.
Thank you. And then we have something that we wanted to make sure folks saw. Carissa Olson said, we at Modoc County Public Health get a monthly report from our local poison control center. It took very little to get that set up and has been invaluable to help with seeing what kinds of mistakes are being made in our community so we know what kind of messaging to push out. That's great. Thank you for sharing that. I think we might have time for just one or two more questions. We have one that came in about, have you seen any geographic, income, or racial inequities in the data on child poisoning?
Yeah, so thank you very much for that question, and that is an important and topical question. We have looked at that in the past, and in the past we have not seen actually large differences by demographics, geography, sex, and race. And we saw that this was a phenomenon and a problem that cut across socioeconomic groups, racial groups, and rural and urban groups. We are right now working on trying to do some more detailed analysis, but we really think this is a cross-cutting issue across groups right now.
Thank you, Dr. Budnitz. I want to thank all of our presenters. Thank you so much for sharing your expertise and your resources.